In the heart of western Pennsylvania lies a city that changed the world, Pittsburgh, a city forged in steel and reimagined through science, medicine, and innovation. It was here that the University of Pittsburgh, originally the Pittsburgh Academy, was founded in 1787, a place where ideas grew into global solutions. We came to the University of Pittsburgh to explore why it is such a dominant player in the medical field.
I think the ecosystem. The first thing I would say is the location of the University of Pittsburgh. We have so much collaboration with University of Carnegie Mellon University. We have so much collaboration with UPMC.
To learn more about the ecosystem and communities surrounding the University of Pittsburgh, we decided to visit other departments as well as UPMC.
But what I do know is that there's great collaboration between School of Medicine and Chemistry. So, for example, Dr. Peter Wipf of our department, he has a lot of collaboration with the med school. He even on the grad school level encourages the students to take medicinal chemistry.
A prominent figure that keeps reappearing when connecting the chemistry department at Pitt to biological breakthroughs is Dr. Peter Wipf. Using his background in chemistry, Dr. Wipf has published numerous papers on medicinal chemistry and how prior knowledge of natural substances can be used to tweak them chemically in order to create more effective and usable products in the pharmaceutical industry.
I would say is the cooperation between the University of Pittsburgh and the UPMC. Let's say for the medicine improvement, we have science and practice. So for the science, we have University of Pittsburgh, School of Medicine, School of Pharmacy, School of Public Health, which can generate research results to provide some insight to the clinical practice. And for the clinical practice, we have UPMC, which can collect the data and translate the research results from the university into a real-world clinical setting. I think that really creates a strong circle of evidence-based medicine.
By the 1950s, polio struck fear into every family. In 1952 alone, over 57,000 Americans contracted the polio virus, thousands were paralyzed, and many died. However, in what would become Salk Hall at the University of Pittsburgh, Dr. Jonas Salk and his team created the world's first successful polio vaccine in 1955.
I would say that the basic thing that actually led to the development of the polio vaccine is the public health crisis. At that time, there was high level of disabilities and dying of infants and babies within that time frame, and there was public advocacy for development of vaccine that would take care of the poliomyelitis. So, and then with many funding organizations interested in funding this event and making sure that the vaccines were developed. The vaccines was actually developed by the Dr. Salk Hall and teams within the University of Pittsburgh Medical School. And then there were many other people who are really doing the same thing at the same time around the world. So it wasn't just the United States or University of Pittsburgh doing the same research. So that was basically why the vaccine was developed.
Two reasons. The first reason is the pandemic of the polio. At that time, polio can cause paralysis or even death, and with no cures and frequent outbreaks, there is an urgent need for a prevention or a solution of disease. And for the second reason, I think is the Dr. Jonas Salk. He really cares about the patient. He even tested the vaccine on himself, his team, and his own family. And he didn't ask for a patent vaccine because he wants the vaccine to be accessible for everyone needs it.
The National Foundation for Infantile Paralysis, now known as the March of Dimes, made a big push to put polio at the forefront of people's minds, showing the public that it was a more deadly and significant disease than it really was. In fact, during the height of polio, 10 times as many children would be killed in accidents and 3 times to cancer. Still, the exaggeration brought by the media and these organizations were enough to bring funding to places such as the University of Pittsburgh to create a breakthrough cure.
When it comes to the research done by Dr. Salk, before the research done by Dr. Salk, most of the research done for vaccine development, we are using live viruses to develop these vaccines. But Dr. Salk used inactivated, that is, said killed viruses to develop these vaccines, and his own was very, very effective, and that actually gave University of Pittsburgh the name and then the credence that we had in the development of the vaccine.
So Dr. Jonas Salk was the lead scientist, but I have to say it was really the team efforts. He worked with the dedicated researchers at the University of Pittsburgh School of Medicine. And I have to say community also played a role here. Like the children in Pittsburgh are among the first to receive the early dosage, the test doses. I would say the support and the trust from the community also are very, very important. And so while Dr. Salk is rightly credited, I would say the collaboration between the scientists, the university, and the public is also very important.
On February 23, 1954, children at the Arsenal Elementary School in Pittsburgh were among the first to be given the early prototype of Salk's polio vaccine. Even while a faulty batch of the vaccine caused an additional 200 cases, there was still a great amount of public trust in Dr. Jonas Salk and the virus research lab at the University of Pittsburgh, giving the team time to increase their production standards and eventually administer 4 million shots of the vaccine by August of 1955.
People really want to, put it on one person, but I think it's a team of researchers championed by Dr. Jonas Salk. The building where we are right now is called Salk Hall, and it was named after Dr. Jonas Salk and his team of researchers. So they were the one that developed the research between the mid-20s, that is 1945 to 1955. That was when this vaccine was developed within the School of Medicine.
Salk wanted to make sure that an effective polio vaccine being distributed to the people was the primary objective of the team's work. With the polio vaccine created, Salk and the National Foundation, March of Dimes, pushed for the government to buy and distribute the vaccine. But the laissez-faire tradition of medical economics discouraged the government from taking these steps as they feared that the government distribution of the vaccine would establish a dangerous precedent. A few years after the distribution of the vaccine, an official from the Department of Health, Education, and Welfare stated that once that precedent was established, the next vaccine discovery would go the same way. Our administration had a different policy from that, Carter 303. Even when the government did step in, their efforts were short of the people's expectations.
Dr. Salk and his team conduct the early lab works, animal studies, and the small human trial to prove that the vaccine are safe. And I think these early steps really laid the foundation for the later large-scale nationwide vaccine test.
With what the polio vaccine did and how it eradicated polio around the world, I know there are very few instances of this thing re-emerging in few countries, but I know that it's reaffirmed that vaccines really work, and they are not just myths. Like, people really, is kind of reaffirm people's confidence in vaccine. I know there are some religious attachment that people still have around vaccination, but the development of polio vaccine really made people understand that vaccines really work. And World Health Organization most of the time cites the polio vaccine development in Pittsburgh as one of the major things that makes people start, buying the idea of vaccination around the world.
The World Health Organization, the WHO, cites the polio vaccine created by Dr. Jonas Salk as the first successfully created vaccine. By 1994, the WHO deemed the Americas as officially polio-free, with the Western Pacific region in 2000 and the European region in 2002. The polio vaccine is still being distributed today, with major cases existing in some third world countries.
So I think Pitt will keep advancing in two key areas. One is precision medicine and one is aging-related research, especially Alzheimer's disease. So for the precision medicine, the concept is mainly about different people will have different treatment response, even they are on the same treatment.
If I should say, right now, everyone is going towards AI and big data, and Pittsburgh stands to be also in precision medicine, personalization of medicine. University of Pittsburgh and much of our collaboration with other institutions within the Pittsburgh area and UPMC looking into how medicines can be personalized to individuals, so we don't have to do one who fits all for treatment, And then when we talk about big data management, we have incredible organizations within the Pittsburgh area that are really digging deep into personalization of medicines, and this is where it's happening at University of Pittsburgh.
We now understand why the University of Pittsburgh stands as a pillar of healthcare innovation in the United States. Through deep collaboration with other institutions, enduring public trust and support, and a bold vision to integrate cutting-edge technology into medicine, Pitt is not only ahead of its time, it is poised to honor and extend the legacy of the pioneers who came before.